Slocum, I'm the chair. The agenda pack with papers is available via ModGov or directly from the council's website from the link which was sent out to all members. I'm requesting that other members and officers turn off their microphones and videos, but please remember to turn on the microphones and videos when you speak. This helps with the background noise, call quality, and anything disrupting the meeting. When I invite somebody to speak, could you clearly state who you are for the benefit of anyone who is listening to the meeting so they can identify who is speaking? Can I also remind committee members to use the chat function solely for committee business, otherwise it's distracting and we realise that. Agendas are now viewed electronically. Could I request that members and officers refer to page numbers from the published agenda pack to assist all present in finding the appropriate information? And obviously all mobile phones, I think we've said this, all mobile phones to be turned to silent if that's possible, please. Oh no, it has to be possible, sorry. Okay, right then. We will be having a short break after agenda item 7, just to let you know the format. So item 1 is apologies for absence.
Thank you, Chair. Good morning, committee. We've received apologies from Councillor Woods, for whom Councillor Osborne is substituting. We've also received apologies from Councillor Pearlstone and Councillor Hobbs. Also received apologies from Exec Member Councillor Oakes, and Committee Member Councillor Govia is online.
Before I start the next bit of the meeting, I'd just like to us to all remember we haven't, Christine Lawrence is now not a councillor and she's left this committee, and she was a very valued member of this committee, and I know we're all going to miss her very, very much, but just wanted us to keep in touch with her. I'm sure she'll be really pleased. But thank you. Item 2 is the minutes of the previous meeting, which is pages 9 to 24. I'd just like to advise you that the draft minutes include a supplement, additional information asked for by the committee about community hospitals. The community hospitals will be spoke about on the work programme, so just to let you know. So do I have your agreement that those minutes are correct, please? Certainly, Councillor.
Can I just say, I've just been looking through the top, page 14 at the top, it says, could the member explain where we as a council focus on travel? And I don't think that's what the question was. And I then answered it saying what we were doing. I just thought focus on travel and really capture what was asked. I can't remember. I wonder if we could just check.
Was it the journey of travel or something like that? I think something like that, the direction of travel. Direction of travel or journey of travel?
Yes. Where we use the council focus on direction. I just don't think it makes sense, that's all.
I think direction of travel.
I think direction of travel. Yeah, correct. We'll have that in.
Thank you. Thank you very much for that. Thank you. Everyone else happy? Silence minutes. Oh, Councillor Osborne.
Well, there was a sort of point page update from the ICB. I assume it's their minutes. It's a couple of questions I've got. Now that the programme is live and they're undergoing testing, what contingency plans you probably have to go back and get answers to those, that's fine.
Sue, Councillor Osborne, sorry. This is just about the minutes are correct. Are you saying that the minutes aren't correct?
No, I'm not, but I do think that there's a 5-page supplement added to the minutes, and that in itself does raise a couple of questions. Are we going to be able to ask questions on that amendment?
I'm sure we will be able to, yes, don't worry. This is just about the accuracy of the minutes, and we'll sort that in a minute. Thank you. Item 5.3, sorry, is declarations of interest. Invite members to declare anything. Your interest or personal members' interest as members of district, town and parish is available on the website. Do I have any other interest? No? Fine, thank you. Item 4 is public question time. I don't think we've had any late questions come in from the members of the public. Oh, hard to hear. That's not normally something I suffer with. So yeah, no, most people don't want to hear me. So good. Okay, so I hope that's fine. Everybody can hear me fine online. Is that clear? Online, can you hear me?
can hear you, but it's not. But it's very distorted.
So sorry, where's the chair? Thank you. We'll just get this sorted. One moment. All right. I'll bring it a lot nearer. Okay, thank you. Right. Item 5 is the work programme. And as you can see, I'd like to advise the committee that there is a shared lives item which will be provided to the committee members as an information sheet. This has made room on the agenda for other items. So do you remember we did talk about some issues that we were going to put on there as a sort of a briefing information sheet. Regular performance reporting from the council and NHS is being timetabled into the committee's forward plan to receive this on a regular plan basis. So we're going to keep everyone up to date with everything. Okay. So I'd now like to invite Emily Fulbrook to provide a verbal update on the voids and overdue care act assessments, as reports were not available before the meeting, which was very disappointing because obviously it is important that we get those reports at the meeting, but I think Emily's going to explain. So over to you, Emily, please.
Thank you, Chair. Just in terms of the voids, and I believe this relates to the housing voids, these don't actually sit within the Adult Social Care and Housing Directorate. They remain within the HRA. So what I will do is get an update from our HRA colleagues and make sure that that is shared with the committee members in terms of the voids. In terms of the overdue Care Act assessments, I'm going to provide a verbal update today, and what we will be doing is within our adult social care performance reports, we will make sure that there is a detailed update that is provided. But just to give you a bit of an awareness and assurance really in terms of our overdue assessments. So on average, across the adult social care service, we complete around about 480 Care Act assessments per month. On top of, additionally to that, there's also a 550 reviews that are also completed on a monthly basis. Today, we stand at 198 overdue Care Act assessments, which is a significant improvement that has been made across the service. We've seen that increase in productivity within our Care Act assessments and our reviews, and we continue to monitor this through our operational oversight meetings, our finance and performance meetings, and our practice quality board as well, with regular audits that are undertaken to ensure the quality of is there within our Care Act assessments. Our West neighbourhood areas are performing really well in this area, and our challenges remain within the South Somerset neighbourhood. There's various mitigations that have been put in place. So we've got community hub days that have taken place, and we've got various collaborative working alongside our health colleagues in order to reduce the Care Act assessment waiting list there. We continue with our shared practice and resource options are continuing to be explored to make sure we've got that agile workforce so that we're working across the areas. But as I said, a full report will be produced as part of the Adult Social Care Performance and Review brought to Scrutiny, and this will include a breakdown of areas and teams to better understand the challenges with it across the area. There are a number of, in November, we're also taking a performance report to the Somerset Safeguarding Adult Board Performance Subgroup, and this will be for assurance assurance and oversight to ensure that the work that is being completed across the operational services is not putting anybody at any unduly risk.
Councillor Wakefield.
Yeah, could I just add to that? I just think people need to just understand, if they don't know this, that the Care Act assessments are done initially when somebody applies for our service and needs to be helped, and we have to do a Care Act assessment if they qualify for it, and there's various qualifying stages, which when we come back we might explain that in more detail. When you've had your Care Act assessment, you then have a reassessment, ideally every 12 months. But obviously those figures are skewed because some people need them before 12 months because things have changed so much that they're bringing us up and saying things have changed. I either need more care or I need less care. And then we also have separate assessments for carers themselves. They have an assessment as well, because obviously if you're caring for your loved one, your position might be very difficult. You might need support, you might need respite. So we do those as well. So it's quite a complicated picture. And when we first started to pull the backlog back, we were over 400 in arrears. So we pulled it back a long way. And I think I would also add, just to make it clear, I think every county doing social care has a backlog because people, come in quite quickly. We do deal with a lot of them at the front door. If you ring up or come through a village agent and think you need a Care Act assessment, we might actually say, what you need is a bit of equipment to help you manage in your home. What you need is something different. What you need is to go to a cafe where you can get some company and respite. So quite about 60% of the calls that come into us through Somerset Direct go straight out again without coming through for a Care Act assessment. And that's because the person is satisfied. And if I could just add to that, what we do is now a proportion of the people who ring in and are satisfied, we then ring them up a few weeks later and say, are you still happy? Did this work for you? So we're doing callbacks as well to try and make sure that what we're doing does actually work. Thank you.
Thank you very much for that. I think that's one thing I have to say, you tend to forget about the Care Act, is about the carers. And I think that's very, very valuable, that you always assume that everything's going out there and everything's going to be the same, but actually there can be major changes. So very, very good point. Thank you. Councillor Bailey.
Thank you, Chair. Just some points of clarification, if I may. Emily mentioned that the current was 198 overdues, and I think Sarah mentioned that they come from 400. What's the timescale that those two figures cover? First question. Do you want me to do them all?
Okay, you carry on and then
Well, the next one is just what do you see as a reasonably acceptable point, a number that you'd be aiming for? I don't imagine it'll be 0. So in terms of efficiency and effectiveness, where would that be? And what's the timescale that you'd like to see that being achieved? Thank you.
Thank you. So the numbers that Councillor Wakefield has described have been within a year period. So there's been a significant productivity that has been completed. So we're about 30% increase in terms of our productivity for Care Act assessments. And as I said, we're completing on average around about 480 per month. But there will be new people coming through. So in terms of numbers, it's not going to be 0. So we will always have somebody waiting for an assessment, and it will depend on each area. So if we look at the Taunton and West Somerset neighbourhood area, they have nobody waiting for a Care Act assessment. Whereas if we look at some of the South Somerset areas, I think the maximum number in one of the teams is 32. So we're not talking huge numbers, but we're still talking numbers here. For me, it's about the proportion of time that somebody is waiting for a Care Act assessment. So we wouldn't want anybody waiting any longer than 3 months for a Care Act assessment. We want to be able to reduce that down. And we need to then focus on making sure that people are getting that timely response from us. There's no specific target, so the Care Act itself doesn't have a target, doesn't have a time frame within there. It talks about proportionate and timely assessment. What may be timely for one person may be something slightly different for somebody else. We do triage, and we do what we call a waiting informed approach or a waiting well approach. So we keep in regular contact with those individuals that are waiting for a Care Act assessment. So that is done through our operational service.
The one thing, I just want to ask a question because you just spoke about that. Are you happy or are you just, sorry?
I just wanted to come back.
Councillor Bailey,
just a quick an operational question, really. Are you able to, if it's 0 in Taunton, are you able to swing resources to say South Somerset? So that's possible, yeah. Thank you. I know we've been talking at Martock with social worker to get a meeting in Martock as opposed to Yeovil. So that's definitely be part of that campaign. So thank you for that answer, Annie. Thank you very much.
I just wanted to ask a question. You said about 3 months assessment. This is where I think we need to link this tightly together, because if somebody's in hospital waiting to be assessed to go home, is that the same category but it's not? Can you just explain why there's a difference? Because some people are getting muddled with that.
So if somebody's in hospital, they would not be waived, but because we need to make sure we've got flow within our hospital service. So when somebody's in an acute hospital and requiring further support, that's where we use our intermediate care services. So that may well be what we call pathway 1, so a discharge to assess, and somebody will be supported to a supported home with additional support. The Care Act assessment will then be undertaken once they have completed their rehab.
So once they're home?
Once they're home. If somebody is requiring what we call a bedded based rehabilitation, so that would be either within a community hospital or within one of our care homes, that Care Act assessment would be completed there. They're two separate teams. So the neighbourhood teams and the mental health and learning disability teams don't work in the hospital or within our intermediate care service. It's a different team. So they haven't got I can get the figures up, but when I was looking yesterday, they had 3 people within the intermediate care service where they were needing to undertake the assessment. So it's a different model, it's a different way of working.
I think what would be good for us as a committee to have those 2 models. If you could give, I think, a briefing paper or information paper, because sometimes I think that's where it gets muddled. You sometimes those waters get muddied because there's 2 assessments being done, but they are totally different, as you've said. And I think if we could have a paper on that, it would be really good.
I'm more than happy to do that. I've also shared with members a description of what each of the teams do, because I think it's important to understand the roles, the functions of the neighbourhood teams, the learning disability teams, the mental health teams, and our intermediate care and acute services as well. I'm really happy to share that again. But when we come for the performance report, we can break that down into different areas.
Brilliant. Thank you very much. Councillor Sally. Yeah.
Really pleasing to hear about productivity improvements. But how do you, it might be something you want to go into more detail at a later date, but can you just tell us about how the measure for that, please? Thanks.
Yeah, and it's something that we're really keen to understand and review, because productivity is one key. What we don't want is lots of people going out and doing lots and lots of assessments, but the quality and the outcome for people is poor. So we've got our practice quality board, and we monitor and we audit assessments and reviews as well. We look at our productivity in terms of what we would do, trends of what we were doing last year to what we're doing now. We also look at the workforce availability as well. So look at our recruitment levels, look at our vacancy levels as well. We monitor that as part of our operational oversight meeting, and each team have various different trajectories and targets as well. No one individual is the same. So there will be so when we talk about caseloads, you can't always put a number on somebody's caseload, because actually a social worker or an adult social care practitioner could be working with some really complex individuals that need a lot more time being spent with individuals. So it's monitored and tracked through at a service manager level. But we have those operational oversight meetings that take place. We also have our assurance board, where which our executive director, Mel Locke, chairs, and they take place on a monthly basis as well. So we don't just look at the throughput, but we look at the quality of the work that is being undertaken as well.
Thank you, because I do think we all know this is moving on slightly, but those people that are having care at home, sometimes you see the carer being there for 10 minutes and another caring person is being looked after and they're in there for 30 minutes. And you sort of think, how did they manage to do that in that time scale? But explaining that now has made that a little bit easier, that everyone is individual and their different care needs are different. So that's a really good point, because that's something that I get asked quite a lot, and I feel like that. So thank you very much. Councillor Wakefield.
Just to add also about the Care Act assessment themselves. I mean, this is a complicated process. This is not a 5-minute job. It's a complicated form prescribed by the Care Act. And we're looking at, so it's not, we don't go and see somebody say, oh yeah, you need carers twice a day. Well, just write that down, that's fine. You've got to do their financial assessment as well, because it's a question of whether they get free care or not. And we do have a procedure whereby we know somebody needs care. We haven't done the Care Act assessment. They can have care straight away while we do that, if it's urgent. And so it varies so much, the approach to it, with the person concerned. And some people, quite a lot of people who come for a care act assessment have been doing caring, but they've got to the point where they're not really coping. So they need a bit of extra help. So that doesn't necessarily need to happen the next day, but they are saying, I'm looking after this person, it's getting a bit more difficult. I think I need somebody to help me get dressed in the morning. And that's why, if it takes, say, 3 months, that's not a disaster. And what we found was, when I spoke to the carers, and this is why we brought in Waiting Informed, was that people were saying, I can wait, but I can't wait if somebody doesn't tell me how long it's going to be. And so I said, let's make sure they know roughly how long they're going to have to wait, because they've said they can cope, but they can't cope if there's nobody telling them. It could be 6 months, it could be 3 months, it could be next week. So that's what we're doing. And I think that has been feedback from that. And we do co-production for most of the things we design now with care experienced people. And that has been really important.
Thank you. Those are really good points today. I think that's explained. So thank you for that. Councillor Osborne.
Thank you, Chairman. You commented, Sarah, that we do follow-up calls to people where we give them another route other than requesting a call out. What percentage of people do we follow up with those phone calls?
Within the, if somebody comes through from the triage, then we would be following up on everybody is what we would be doing. If that's within our contact centre, then there's a proportion of individuals, because we'll get, I think it's something roughly around about 5,800 contacts per month. So on average, it's around about 10 to 12% of people that we follow back up through.
And when you follow them back up, what percentage of people do you find then subsequently need a care act assessment?
But I haven't, Councillor Osborne, I haven't got that data in front of me. We can get that data, but what we also do is we track and monitor that through as well. So within our assurance board, we look at the individual numbers of people that have contacted us and how many have come back to us within a 90-day period. It's part of the ASCOF data that we need to report on. So we monitor and we look at that on a monthly basis.
Yeah, because that might be something that's helpful to have. Because my concern sometimes is that someone will ring in, you'll give them the alternative, and then they'll think that's it. They won't necessarily come back to you. And not everybody has got family around them or people to advocate for them. And it's those people I just tend to be concerned that they can slip through the net.
But just to reassure you, we do warm transfers as well. So we do warm transfers to our community agents as well and to our health coaches. So generally people are not just given verbal advice and sent away. We may also offer appointments at our Somerset Independent Living Centres as well. So there's various of information that is being given and then follow-up calls for those individuals where appropriate as well.
Okay, thank you.
Thank you, Emily. Thank you. I think that information, what you've given out today, would be really good. And if we can expand on that at some point, because I think we need to understand as well, so that we can give the right information out. And I think the idea of being monitored, the monitoring system that's in place now, I think it is really good. Well done. Thank you. Thank you. Is there anything else, Emily, you need to say? You're fine. Good. Well done. As we members, as we move into the last quarter for this year, we've been asked to take this opportunity to review the committee's forward plan and identify key areas of focus for scrutiny for next year. So you can see the forward plan in front of you, and we need to also set up and implement recommendations, obviously out of the scrutiny's review agreed at full council. So I'm proposing the forward plan is on the agenda for the January 2026 committee meeting, where we can literally talk in depth about the forward plan. Anybody got any comments about the forward plan? Councillor Trimnell.
Thank you. So obviously the Housing Task and Finish group, that needs to come back to the committee at some point. So I'm assuming that will be factored in somewhere. I also just wanted to ask, and it was difficult, I didn't know whether to ask earlier with the minutes now or with the homelessness. So I thought if I went for the middle point, then that would be very effective. So I just wanted to check. So last month or at the last meeting, I asked whether we could have a briefing on homelessness, and I see there is a briefing. Is that the briefing that, because it's also homelessness and home finder, and so I specifically really want to make sure that us as councillors can be told what we have to do or what we should be doing, and I wanted to just make sure that was that.
Kirsty, can you?
Thank you, Chair. Yes, just to confirm, that is that. So it will give guidance to councillors, how you can support people in your communities, which is really important. I know you get a lot of questions about how long am I going to have to wait for housing, how does it work, and there's a lot of misinformation. So it's about giving members information to help them be able to then support in their communities and give that right information, but also to know who to contact if things do need to escalate or there are things that need raising, then you know within the service how to do that as well. So hopefully it will be really useful.
Brilliant. If I may, Chair, just really quickly. So obviously the thing is, you see, sometimes you get reports from people that there's someone homeless sleeping somewhere, and it's those kind of things I really want to make sure we're told what we should do in those instances, as well as the support that helps to prevent homelessness or to ensure that people are informed as to what their situation or how it's going to be managed. So it's that whole raft. I mean, it's just such a huge area within such a huge area. So I just want to make sure that we all know what we should be doing this winter. Thank you.
I think it's important that we as committee members put on the forward plan what we think is very relevant, and also with the idea of giving a recommendation so we can help things move things forward, we can get an end result. So anybody that's got any ideas, and if you want to add something on, if you want to say there's something really, really passionate, not just individually passionate, I'm talking about nationally passionate. It has to be something, we can't just put anything on there. But I think this is why we're asking officers, and they are doing it. So I think we are very lucky. Councillor Trimmer, I knew if I spoke too long, you'd come back.
No, it's only a quick one. So therefore, it would be really good, and this may be something in the strategy that's going to come forward, if we can find out after the winter, so sometime in the spring or early summer, the effectiveness of what happened, the numbers of people, you know, who were referred to various, that would be really, really good as well to come back to committee at some point. I know we're not really going past May, but May looks empty, so I don't know how quickly it would take, you know, be to get that information together.
I normally give a 6 month slot, so I think that gives enough time. But I think most of what we do needs to have a comeback. We need to be able to come back and ask officers, how's it worked? Has it not worked? The good, the bad, everything. So I think if we work on that like we've always done. The May looks empty at the minute, but I can assure you it will be filling up very soon. But I think to look at the next month for November, that's quite a lot of on there. And I think that's a really good agenda item for November, and I think it will in. Councillor Bruce, you look like you want to speak to me.
Thank you, Chair. I'd like us to look at the area that is about aligning housing growth and the capacity of local health services. I know that the Bridgewater GP and primary care services have reported capacity issues and raised objections to new housing developments in their area. So basically, I'd like to see whether we can look at what steps are being taken jointly by Somerset Council and the NHS partners to align the housing growth with the capacity of local health services, and also to ensure timely investment in new or expanded facilities. So how are we ensuring that primary care capacity is keeping pace with new housing development? Whether we could do this through a short review or a task to finish group. I see that in the plan we have got something about primary care services from the NHS. David McClay, I think, is talking about that. I don't know whether this can sort of be involved in that or whether it needs to be a separate item. But I'd really like some more clarity on what we're doing jointly to work together with Somerset Council and NHS partners.
Yes, you're right. Councillor Wakefield.
That's a good question. It is something that I know concerned a lot of people about whether we're going to have a new GP surgery, for example, in Orchard Grove, which is one of the big 2,000 house developments on the edge of Taunton. We do have, and I can't remember the name, I don't know if Emily can, there's a body in the council that collects statistics, which the NHS find very valuable about population growth, age range, all those sort of things. And they've reported recently to one of our committees actually. And I know the NHS, yes, the JSNA, I can't remember what it stands for. Joint Strategic Needs Assessment. Yes, so they are collecting the data, and the NHS certainly pick up on that because they were there when we were discussing it at the board meeting, I think, of the Foundation Trust and Somerset Board, I think it's called, isn't it? So they do pick up on that, but as I've had to say to people locally, near where I live, about Orchard Grove, it's what the developers and what the planners are telling us is that if you put in a doctor's surgery, and they've done this over the years, the doctors say, well, we don't want to put it there, so we're not going to come. And so they don't put in doctor's surgeries now as part of the facilities, you know, for the shops and things like that they put in. But the doctors and the primary care people will say where they want to be. But the other thing is with the NHS 10-year plan and the whole change of the way they're going to operate, they may not be setting up new surgeries in the way that we understand them to be. They may be setting up hubs for people to go to. And they've been talking about that in some of the meetings we've had. So we will certainly ask the question, we'll certainly report back on it because it's a very good question. But I think the way the change of the NHS are going, they won't be setting up lots of individual doctor surgeries in the way that you and I understand. That seems to me, from what they were saying last time we spoke to them, is not what they're going to be doing.
And you're happy, Councillor Bruce, do you wish to come back? No, I'm sorry, that's the wrong word to say. Ever changes, ever changing.
Yeah, thank you. I think it's just because to get to the point where a GP surgery is actually submitting an objection to a planning application is quite serious. For them to come out publicly and say, we are full to capacity, we cannot cope anymore. And this has come to my attention because of Bridgewater, but obviously we're looking at a wider context, county-wide. And like you say, there's issues in Taunton as well. I think it is just about how we're feeding in as a council. It's not just what the NHS are going to be doing. We need to be proactive about saying this is our county and these are problems that we need to solve together, and be clear to the public what we are doing as much as possible to solve those. Thank you.
Councillor Bailey.
Thank you, Chair. Just a few points really. I just wonder whether we can't, bearing in mind, as I understand it at the moment, that we've had difficulty in getting timescales from the NHS in terms of the maternity situation. And also, particularly, I just noticed on for November, 2 points really. I wonder whether that should be on regularly, because I'm just amazed that there isn't the size of organisation there doesn't have an understanding of project planning and timescales. And that's what appears to be there, but there may be something that I'm not aware of. I'll perhaps go through all my questions if I may, and then perhaps you can pick one up at a time.
Yes, sure.
So I wondered whether that could be on more frequently, and possibly, I see it's on Musgrove Park maternity unit in February, but I think probably it ought to be, I would suggest, maternity services, because they're combining the two. And if I take them separately, may actually miss some of the points that they're trying to make in terms of improving the service. But we've still no idea, as far as I'm aware, in the Yeovil area when that's going to be back, and the timescale and what it's going to be like when it comes back. So that's the first thing. So a lot more frequency on that, and that may apply to stroke services as well. Second thing is to come back to perhaps to follow up a point from Councillor Bruce, was that when I look at planning permissions, and I picked up one particularly at the moment, recently rather, where the NHS contribution was completely inaccurate. And I'll give the example. It was in Ilchester where there was a planning application came on. They said there was adequate space, scope, capacity, wherever it is. In fact, the Ilchester surgery does not do GP appointments, so people are required to get a bus to Somerton to get there. So in fact, when I made them aware of that, they realised they should have actually taken account of that in their planning comments. And it was at the time also when the 52 bus was under threat anyway, which was the only bus service. So I'm not really sure whether when they make these comments, and I was given access to certain people and had a consideration from them that it would change in the future, and they were very supportive. But when these comments are made in planning applications, they are taken into account in the full. And if they're inaccurate, completely inaccurate like that one was, then, you're actually making decisions on inaccurate information. So that was just to follow up on Councillor Rose's situation. And I know my local surgery is 106%, and there's two applications for about 80 houses coming in. So again, how did that work? The third point, sorry, I made a few here. The third point was about nationally, there's a change in the way the NHS is structured. There's a whole tier. I'm sorry, I don't know all the acronyms for this. Has been taken out. Yeah, thank you, Sarah. And that's going to have an impact on the service. As far as I understand it at the moment, from just the press, NHS is struggling to find out, to move these people on, find out where they're going, to sort out the redundancies. And so, is it going to happen? If it does, what are the impacts on the service? And that might be part of the service changes which we're reviewing in November. And I just wanted, you asked about more global comments. I just wanted to make sure that was covered. Sorry, that's all the questions. Thank you.
I'm going to answer this because I think it's important. On our November meeting, we've got the impacts on NHS services changes. I don't mind expanding as much as we want on that. We can expand. We've got the impacts on service changes on ambulance service, talk to Yeovil because of maternity. We're talking about everything. We can talk about Taunton. We can talk what we've actually said on the impacts in February is because we need to give time for them to assess the impacts. As we all know on planning, we talk about the buildings only. We don't talk about the reasoning. We're not allowed to do it. It's bonkers, but that's how it is. So that's why sometimes it never seem to meet together. We agree on a building that we know is plannable, but actually it's not the right place or something else. Well, that's not in our remit. So there's a difficulty there. But in our November meeting, Councillor Bailey, I want you to come to that and have as many questions as you want, because that is what that's all about. It's about impacts on NHS service changes, and our officers will have the answers to our questions, and you can expand as much as you want on that. I'm quite happy.
Thank you.
Is that all right?
Well, the other question was increasing the frequency in which we get. The other question was increasing the frequency in which we get reports back on the effects of the maternity changes.
But we have to. The thing what I'm very clear about. We have to wait for a time scale. We can't, I know we want this on every time, but we can't. There's too many other things to talk about, but we have to give our officers the opportunity to go out there and assess the changes, to be able to come back and report it and be able to get the proper findings for us. So there has to be, that's why we often ask for 6 months, but they're not going to be forgotten. That's why they're here again, but we can't keep having them every month because there's too much to expand on. But I assure you, if after our next meeting in November, you don't get the answers and we aren't happy about certain aspects, then we can bring that straight back.
Yes, I appreciate that point, and I think that would be great if we had an idea over the time scale that these are operating, but NHS, as far as I understand, is still not committing to the time scale on the maternity changes. And I'm quite happy to have written responses and not to take up the time of this meeting, if that would be a understanding for residents who are in these things.
Yeah.
Every parish council.
I think in the November meeting, David McClay's coming. I think we'll have other people there from NHS who will be able to give us those answers. So if you can just wait for the November meeting, and trust me, I'm not a doctor, but trust me, if we don't get the answers to those questions, then we will be saying, okay, we need further. But I think they know we want those. That's why we've made that. We've made this for November. We've given them time, opportunity to assess what's happening. Okay.
Thank you, Chair. But don't be surprised if I asked the next meeting when's our next pick up. Thank you.
Absolutely, and please do that. I need to be kept on my toes. Thank you, Councillor Osborne.
At the November meeting, will we be able to ask about the progress of that community review? Because as I say, they did send an 5-page update add to the minutes. So in effect, we've not had a chance to sort of question on that, and there are questions in there that should be asked, such as, for example, what is the contingency? If it doesn't go to plan, what happens then, and other things. And also another thing we need to consider as well, Jill, is that yes, they want to sort of get people out of hospital fairly quickly, but if they come into our pathways, that's impact on our budget, but maybe that's for the budget item, I don't know.
Yes, I think so. I think I'm going to have my last speaker now, Councillor Bailey. Oh, no, I've done Councillor Bailey. Councillor Chung, but that's the last speaker, please. Oh, Councillor Bruce. Okay, no, I can't deny Councillor Bruce. Let me go to Councillor Bruce first, and then I think we must move on because we're not going to get through today's agenda.
I'll be really brief. It was just the suggestion that that November meeting looks quite meaty or might become quite meaty. Can we please have an option to submit questions to be included or responded to in the report? So we save a bit of time rather than toing and froing for another meeting.
I think that's always an excellent idea, and I think especially for officers, that will help anybody who wishes to submit a question. If you could CC me in a question as well, I'd be really appreciative of that. But I think that is a very, very good idea. Thank you, Councillor Bruce. Well worth going to you. Absolutely. Mr. Jackson.
Thank you, Chair. I just want to say I absolutely agree with Councillor Bruce's point that the November agenda is looking quite meaty. I think therefore that we would probably be wise to go into that meeting assuming a 4-hour window rather than the standard 3-hour. So if members could try their best to accommodate that within their diaries, the meeting invite should be 4 hours. If it's not, we'll get amended, and we'll obviously make sure that we have a comfort break during that. But I think it's unlikely to be done within 3 hours. That meeting. So.
It might be a good idea. We've got scrutiny of the crime and disorder in November. I'm just wondering whether anyone would mind if we maybe move that one to the January so that we go straight into the impacts. But we'll talk about that after. So we may, because I think sometimes it's really good to go into the whole issue. Okay, so I think that's great. So Councillor Trimmer, you've got 3 seconds.
So really, really quick, regarding the planning question, I just think it is really important that we have an overview of that. Went to a planning briefing recently, 650 homes, GP services say they need no extra money for provision. Could you just hold some in abeyance? And I would like to know that we were able to keep a track of that as a council to make sure that that provision or that money doesn't get forgotten about. For example, do we have the ability to oversee things like that?
Yes, I think you're absolutely right. I think we will get on, but I think we need to move on now. So I'm going to move on now to item 6, which is the homeless and rough sleeper strategy. And I'd like to welcome Kirsty Larkins to our, and I just wanted to sort of say, you're going to talk about the rough sleepers during the winter months, the preparation for the winter months, etc. So oh, and I'm going to ask for Councillor Wakefield. Sorry, she would like to. Apologies, Councillor Wakefield. It's on the next page. Can you just introduce, please?
Yes, thank you, Chair. Well, I'm very pleased that we're bringing this forward. Obviously, I would say that, wouldn't I? But we did bring the strategy to council I think at the early part of this year. And since then, we've been working on the action plan, which Kirsty will set out at a fairly high level. I just wanted to say homelessness and rough sleeping is completely separate from Home Finder. Just to make everybody absolutely clear. So people who are on the Home Finder register may be kind of technically homeless. They may be sofa surfing or sleeping in sharing with somebody temporarily. But if they become homeless because that falls apart or they end up being thrown out of the accommodation they have got, then they might come into our homelessness. Otherwise, Home Finder is separate, although very overcrowded, as you know. I just wanted to make that point at the beginning, because we have to keep them separate. We've got separate teams dealing with them, but obviously you might go from one team to the other should your circumstances change. So the action plan, there's lots of things we want to do. The main thing we really want is more money from the government so that we can get more homes for our people in Somerset. And that means possibly buying them, possibly building them, but I'm persuading landlords that it's a good thing to let to us so that we can let properties. We just need, the homelessness thing and the rough sleeping is a thing where we need money and we need it from the government. And they are doing something, but it's going to never be enough. I'll just start with that thought.
Excellent thought. Over to you, Kirsty.
Thank you, Chair. I've just got a few slides to run through and then there'll be plenty of opportunity for questions and discussion at the end. So just to remind members of the recommendations, it's to note the content of the presentation and both action plans and agree that updates come back to the Scrutiny Committee every 6 months so that you are able to oversee the delivery of this plan. So very short introduction because you have seen the full document previously, but it is a statutory requirement for us to have a homeless and rough sleep strategy. And as Councillor Wakefield said, it was formally adopted by the Council in February this year. Since that, we have been working closely across our Homeless Reduction Board, which is a partnership of over 40 partners to develop the action plan. So when we were developing the action plan, it was to look at the key findings of the strategy and also to incorporate feedback we'd received during the public consultation. So just very high level reminder, and I appreciate you won't be able to read this if you're looking at the screen, but the vision for the strategy is by 2030, all elements of local government in partnership with the voluntary sector, businesses and wider society will be working together to ensure that everyone in Somerset has access to secure and suitable housing with appropriate support so that no one should have to experience homelessness or rough sleeping again. We see that as a very ambitious vision, but we want to be ambitious because things do need to improve. We do have a housing crisis in Somerset and we need things to improve rapidly. The impact should be that homeless and rough sleeping will be prevented, and where it does occur, it will be rare, brief and non-reoccurring. So sat under that strategy are 4 working groups, one focused on increasing early help and prevention, one focused on ending rough sleeping, one around suitable and affordable accommodation and support, and then the 4th around data insight. Just to link it back to the Somerset Council's priorities, that links to the healthy and caring Somerset, so provision of safe and appropriate housing and working in collaboration with partners to influence the support services available in the community. It also links to a fair and ambitious Somerset, the provision of affordable housing, provision of decent low carbon social housing and an innovative approach to housing and supporting people. There's 2 documents as part of the pack. The action plan for the main strategy starts on page 39, and beneath that sits a rough sleeping action plan, which starts on page 47 of the pack. I just wanted to also briefly mention, as part of the Homeless Reduction Board, we have been developing a Somerset Homeless Charter. And we will be looking for organisations and individuals across Somerset to sign up to that charter. It's not formally launched yet. It will be launched at the Homeless Summit, which is taking place on the 23rd of October. And that's been jointly hosted by myself and Michael Preston-Shute, who's the chair of the Somerset Safeguarding Adults Board. So the next steps that we're working on is setting up those working groups underneath the 4 themes that I've mentioned to you. They will then develop a much more detailed action plan, a kind of working action plan that sits under those. And we will then define and map out those to achieve the high level actions that are mentioned. We will then provide bi-monthly progress reporting through our Homeless Reduction Board to update our progress on those actions and highlight any areas that need mitigation or any additional work or resources or support. And we're proposing that we come every 6 months to the Scrutiny Committee to provide an overview and update and give members opportunity to see how those actions are progressing, are they working, and input into that. So happy to take questions, Chair, on the action plans.
I just wanted to ask you, Kirsty, if I may, when you go to the on the 23rd of October, you will obviously give us a feedback on how that went, what questions were asked, etc. because obviously it's important for us to know what's up to date. If that's okay, please.
Yeah, no, absolutely fine. Happy to provide a short summary for the committee chair.
Yeah, that'd be great. That could be in between the 6 months, if that's okay. That would be really good. Okay, members, is Councillor Trimnell.
So I have two questions. Firstly, the summit that's being held, you're hosting it. Who will be attending that? And what will the sort of programme be, I suppose? And the 4 boards, working groups that you're setting up, who will be on those? What kinds? Not names.
No. Thank you, Councillor Trimnell. So the Homeless Summit is set at a strategic direction. So we have got people from health, people from the voluntary sector attending, obviously officers from the council, and that's across the council, so adult social care. We've obviously got our lead member, Sarah Wakefield, attending. We've also got members from the Somerset Safeguarding Adults Board attending. So it's a high level meeting. The focus of that meeting is to obviously discuss homelessness in Somerset and the impact that is having on our communities, but also to do some work around mapping out what gaps we may have across services and how we can work more collaboratively together to fill those gaps. None of us have got pots of money, but it's how do we work most effectively to address those key issues that we see in Somerset. And I think you asked about the working groups, apologies. So those, again, will be made up of similar colleagues. So it's colleagues from voluntary sector, colleagues from housing associations, from the council, but also from health. So right across the system.
Thank you.
In your can I ask Kirsty, is there room? Is there a space for the shadow lead member? Or is it just the lead member? Because Councillor Trimnell is the shadow. Would that be possible?
I can certainly ask and find out, and I'll come back to you.
Thank you. I just think there's many, sorry, I'm giving you another job, Lucy, I apologise. But I'm just thinking it might be helpful to everyone as well. Because I'm relying on Sarah for nearly everything, so it'd be really good if, and Emily, so that'd be great. Thank you. Councillor Bailey.
Thank you, Chair. Yeah. Thank you, Kirsty, for your comprehensive report. The area that is missing for me really is in the action plan is any numbers. And as you rightly point out, we haven't got pots of money, but I'm not sure how that money's been allocated. For example, I just picked the first one, 1.1 review and design. And progress and tracking has got a timescale on there, but increasing the numbers of cases prevented. There's no numbers against there, so we can't really see what your success levels are really. And I could follow that line all the way through probably. I'm sure you've put them somewhere, but it'd be useful as a scrutiny committee to know what, as well as the pots of money that we haven't got, where the value is coming from as well. Thank you.
Yes, we have got those figures and they will be added, and there will be a dashboard that will come to this committee. So you will be able to see that direction of travel and obviously the target. So our target around prevention is to prevent 50% of cases coming into the service from needing bed and breakfast accommodation, temporary accommodation. At the moment, I think we're around 39%, so we're away from where we want to be. But that will all come to this committee as part of a dashboard.
Thank you.
And Councillor Osborne.
Thank you, Chairman. I hope this follows on from Councillor Bailey's question. Because there is sort of finance in terms of financial sustainability and risk. So how will the new roles, data systems and the joint commissioning that proposed in this, how's all this going to be funded beyond the beyond the current financial year? And what contingency plans, if any, have we in place to deal with budget pressures of partner funding reduction in terms of how those will impact delivery?
Thank you, Councillor Osborne. So we receive at the moment 3 separate grants from the MHCLG. So one around what's called the Homeless Prevention Grant, and then 2 specifically for rough sleepers. However, we've been advised by the MHCLG that those 3 grants will be rolled into 1 grant moving forward. with a much greater emphasis around prevention of homelessness, whether that be rough sleeping or other types of homelessness. What will be slightly different, we understand, and this hasn't been confirmed yet, it's still going through that consultation processes. At the moment, part of that grant contains money for temporary accommodation. Our understanding is that will now form part of the settlement that the council receives, so it won't be separate anymore, it'll be part of the full settlement we get, but we will still have a homeless prevention grant to commission those services moving forward. We don't have the detail on how that will work. From mitigation point of view, it probably tips into the final presentation around temporary accommodation. So by far at the moment, most of our spend is on temporary accommodation, and I'll talk in quite a bit more detail about how we are trying to mitigate that spend and reduce it down, not only from a cost perspective, but also from an outcome perspective. We know that being in temporary accommodation has a huge impact on children's and individuals' sort of life chances and their health and the way they progress through life. But so it's not only for me the cost, it's that impact that we have moving forward.
Okay. And that's because some of what I've asked will probably be covered in the final item. Thank you.
Yeah. Councillor, I'd like to introduce our new councillor, which is really remiss of me not to really introduce him. It's Councillor Derek Perry. If you'd like to stand next to Cedric.
Maiden speech.
Yeah, maiden speech, and welcome. And I hope you do enjoy this committee. Thank you very much.
I'm going to ask about Action 1.5, which is to strengthen partnership working across Somerset, including introducing a homelessness charter. And in relation to the outcome, the first paragraph is all organisation and services are working together to deliver excellent homelessness prevention and support services. And the timescale is December 2026. Do we read into that at the moment, the view is that all organisations and services are not yet working together to deliver excellent homelessness prevention and support services?
We are working together, but there is always room for improvement, and we've got services that previously haven't been as aligned as well as they could. So I can give you a great example between adults and housing. We haven't always been as aligned. So recently we've started jointly commissioning services together. So again, we get much better outcomes for those people. It's more cost effective and we get better outcomes. Again, we've got very good working relationships with the voluntary sector, but sometimes we're not all aligned as we should be, and sometimes there is duplication in the system, and we could remove that and then use that funding to be doing something else. So it's about working on the good relationships we've got now and improving those and getting those better outcomes.
How did we, I think back historical context, obviously the board was born out of the Everyone In directive. Read the wording of the vision talking about getting to a situation where nobody has to be rough sleeping or homeless. That very much echoes the wording of Everyone In. Back when that happened, Everyone In 2020, 2021, we all remember it. I think certainly in Somerset West and Dorset, it then was we got to a point where I think we could fairly say for the most part that nobody had to be homeless. People who make decisions and life choices, as they were. How have we got to a point then where we're no longer in that situation? Is that just a result of decline in funding for post-COVID for that kind of working?
It's a combination. So we did receive huge amounts of funding as districts to be enable us to do that Everyone In campaign, which was hugely successful and absolutely the right thing to do. We no longer receive that level of funding. What we're also finding is kind of post-COVID is people are much more complex. So we are seeing that mental health is more complex, and there's often kind of substance misuse that sits alongside that. So people are much more complex now as well. So it's more difficult to find that accommodation. So part of our work is about commissioning services that we can enable those more complex people to move into, work and have the support, and then hopefully move on to more appropriate accommodation that's longer term accommodation. Sometimes people will need that support for a very long period of time, but funding is one of the key things.
Well, and then finally on that, so the charter, I presume that certain amount of resource, human and financial, is going to have to go into the charter. Why do we need a charter to get people to work together? Why can't the resource simply be put into getting them to work together on the basis that all these organisations know of each other, already working together? Why do they need that piece of paper to make a difference?
So for me, we are working together. You'll be pleased to know it hasn't cost us huge amounts of money. We don't have those, and we don't want to kind of spend huge amounts of money on things like that. But this is about that much more community basis. So we want to get businesses to be signing up to the charter. We'd like businesses to give opportunities to homeless people, give them work opportunities or volunteering opportunities. So it's a much more holistic approach to homelessness. Homelessness isn't just a housing issue, it's a poverty issue as well. And if we can address those poverty gaps that we've got, then that supports us addressing homelessness and making people able to sustain a tenancy, feel valued in society, and kind of move on through and make a positive contribution.
Thank you, Councillor Perry. We gave you a little bit longer than normal, so thank you. Well done. Councillor Sully.
This is a question with permission from the chair, whether the chair is happy for me to answer this question. It's to do with, anecdotally, I've been told that ex-prisoners are coming out in increasing numbers from, a member told me they've noticed some homeless people that were in prison and they've come out early. I don't know if this is true, but my question would be, are you seeing increased homelessness in that scenario? And if so, is that a partnership? Is there a partnership with the prison service that's required? But as I say, it could be a written response and it could be something to go via the chair. So it's up to the chair.
Sorry, I wasn't aware that content of that question, so you may not have the answers for us now, but it is a good question. So it might be something. Can you answer now, or
I can partially answer and then come back with some more figures. So we are seeing, there's a national programme to release more prisoners earlier from prison because prisons are overcrowded. So that absolutely is happening. We are having more people released in. We do have good relationships with probation and with the prison services, but there is room for improvement in some of those areas. I've been recently made aware that we have had some prisoners released. They should be released into accommodation. That is always the way that we would work. We normally get a referral in from that prison service or probation to say someone's coming out, and then we look to release into accommodation. And we do commission services specifically around those prison leavers that are not going straight onto the streets and then re-offending and then back in again. But we have had some blips. I can come back to the committee with the detail around the numbers that we're seeing coming through that and the numbers we think may be going on to rough sleep and the numbers going into accommodation.
Thank you very much. Thank you. Does any, sorry, Councillor Wayfield.
Yes, if I could just say a little bit on the rough sleeper situation and the homelessness. We do quite a lot of work on prevention, and we've got a team that go out and help people to try and retain their tenancy when they're under threat. And we do advise people, I think Councillor Trimon wanted to know if we do advise people to stay where they are as long as possible and to wait until the court order is implemented if that's what happens. It's not very nice, but if they leave before, they might be thought to be intentionally homeless. And I'm afraid that's the legal side. In fact, probably Councillor Perry knows better than I do about that. But the other thing is, if you see somebody who you worry about rough sleeping, and sometimes we're tempted to talk to them, and that's a very nice thing to do, or even give them money, and that's up to you if you want to do that. But you should report it on StreetLink. Now, StreetLink is a national organisation that links up with homelessness services. And we don't mind if we already know about the person, if somebody rings up through StreetLink and we find out about it twice. We're really happy to know about people on the streets who you think need help. As I say, it's a website, you can find it online quite easily. You can report the person, say, I saw a person outside Sainsbury's or wherever it was, and I haven't got any details, but can you check up? And they will refer it back to our homelessness team. And that's really important because where to go and who to talk to is a difficult one. And we have got an out-of-hours service. I have tried to phone them myself. It wasn't terribly successful. I did get somebody, but they said, oh, well, we're just about to go off duty or something. That wasn't helpful. But StreetLink would pick that up. So just wanted everybody to know that and do pass it on to your fellow councillors.
Before I come to you, Kirsty, I was just going to say, I expect we all know in our previous lives, if any of us were in the districts, we all had StreetLink before. And I remember in Bridgewater always, in fact, talking to a homeless person and getting them housed. They listened to me and then they actually walked with me to the place. So I think but thank you for raising that again for any that weren't aware. But I think one thing I just wanted to say before you come back, I think that we had a lot of media coverage last night about Somerset and about rough sleepers and about the issues. And I know many people who are rough sleepers don't want to be housed, and that's very, very difficult. But I think what we need, Kirsty, we do need more meat on the bone. I want to see how many are rough sleepers, how many you've managed to get housed, how many are not wanting to be housed, and a lot more detail, as Councillor Bailey sort of, you know, kind of remembered that. The thing is, we do need a lot more meat. I want to know if we are progressing, if it's getting better, is it getting worse? Because on the television last night, it sounded like Somerset was pretty dire. And I think that's a real sadness, because I don't think it's as bad. We know it's not as bad. It is bad, but it's not visibly as what came over. Our churches have been really, really supportive, and we all know that. But sometimes they've also suffered, and I think that's the link between the churches. They've been really, really good, and I thank them so much what they've done. But I think we need a little bit more meat, if I could say, Kirsty, if you don't mind, for next time. But anyway, I'll let you to answer that previous. Thank you.
No, that's absolutely fine, and we will provide that as part of the dashboard, so the numbers that we have. Somerset is dire, and I'm really sad to say that. Last year we had the 6th highest number of rough sleepers per 100k of population in the country, and that is shocking for a rural county. You know, we were not very far behind some of the big cities that you would normally associate rough sleeping with. I think because we are a large rural county, it's often hidden. So you see little pockets in Taunton and Bridgewater and Yeovil and across the county, but you don't see that big impact of it. So we are working very hard in that space. We are doing, again, jointly with adults, some housing first projects. That's about getting rough sleepers into accommodation when they are ready to come in. They're not always ready, so it is a small number of those, but directly into accommodation. They don't have to fulfil any other criteria apart from the desire to hold a tenancy and engage with services once they're in, but they don't have to already be ticking lots of boxes. We know that's a successful model that's been operated really well in the east of the county, in Shepton Mallet, in Frome. We've got a number of those that work well. So we are looking now to expand that out across. We absolutely need our housing partners. So a number of our big providers have committed to providing accommodation for those housing first projects. There's a lot of really good work that's going on. The dashboard that we will provide at the next meeting will have that breakdown, so you can see that direction of travel. It'll be a lot more detailed. And can I just say, it's World Homeless Day tomorrow as well. Yeah, we will be doing a press release that will have the link for StreetLink as well. So if you're sort of worried about that and information about what to do if you do find a rough sleeper or you're worried about somebody, and as Councillor Wakefield said, we would much rather have them reported 10, 20 times to us than not at all. So yeah, please do sort of pass that on to other people that might be concerned. It's really quick and simple. It's like a minute to fill it in and do it, and that comes straight through to our outreach teams, and they will then go out in the early hours of the morning and engage and try and link people to services that they need.
Thank you. I wasn't trying to lessen it by saying it's not dire, but I think sometimes when on the television it looks like it's in every shop, every doorway, and it looks so much worse on the television. Somerset's dreadful, and I know this is a big problem. Kirsty, what I would like to ask is, on behalf of the committee, that we've got to agree to receive updates on your action plan every 6 months. I think with this issue that's become so national now, I wonder if it would be okay, could you, bearing on from what Councillor Bailey said, that would you be able to come back in 3 months and give us some figures? Would that be unreasonable? Or I think we need to be on this. I really do.
I'm very happy that we can provide a link to a dashboard that would give you all of those figures. So you then as members can go in and look and see that information and then happy to talk that through, but we'll make that available to the committee so you can track through. And we'll also have that available on our public website.
But if we do need to have you come back in to explain the finite detail, that'd be fine. Yeah, I think that might be, I think it's a pertinent point really that some people do, we need to be on this and we need to know that we're progressing. Okay, Councillor Trimnell and then Councillor Osborne, Councillor Bruce.
Thank you. So it's just a quick one because straight in hand, I did feel that at district we knew more what we had to do as councillors, and that's what I want to get is that promotion amongst us, because we're the people that people come to in our communities to say they've seen somebody. Also, see, it's the issue of when people have been reported, and like you said, not everybody wants to go into accommodation or to have the homelessness problem sorted. Some people choose to live on the streets, and that is a choice. And so it's what I want people to have the opportunity to do is to ask those questions, to understand how we communicate that information, so that when people say, well, I reported and I reported it and I reported it and nothing's been done, we're already armed with the information that helps us to answer, because it is sometimes the case that people also rotate around our towns. So I reported somebody before in Yeovil who was known to have been in Wells before, Broome before that, and so all of that information is just so important, because I feel like it's becoming such a, like you say, it was on the news, it is just a huge issue. And this winter, especially if we have a harsh one, I'd love to be on top of it, that's all. So thank you.
Thank you. Councillor Osborne.
Thank you. Just a couple of questions. So the dashboard you're referring to, which will be generated to basically put the meat on the bones and give us numbers and performance trend, is that going to also appear on the overall performance monitoring reports that go to Scrutiny and Executive? And my second question is, when we do see people who don't want to engage at this point, how do we sort of, support and monitor them to pick up if there's any change of mind, or if they or their health, physical and mental, starts to deteriorate? So as we do have a response when people come back to us and say, oh, well, you're not doing anything. You can take the horse to water, you can't make them drink, but how do we monitor those? Should they wish to change their mind at a later date?
So the dashboard won't go as part of the sort of higher level KPIs, but we have introduced additional ones for housing. I think prior to me being in post, I think you only had one or two for members to see. So we have added a number, and I will briefly cover those and the temporary accommodation, because it kind of links back to there, but it will be much more detailed than that level. As with regard to reporting people, so our teams will go out and try and work with that person. If they are not receptive at that time, it doesn't mean they've missed their opportunity. We continually go back out and monitor, and we also know, sadly, when things do get colder, then people are more receptive to receiving help, support, being enabled to access services. So we are constantly doing that. And even if people won't come in during cold weather, when we have got provision, we will provide hot drinks, additional protection against those weather conditions. Our preference is to get them into emergency accommodation, so we have winter accommodation that we provide, because then we can start working and our agencies can start working much more collectively with that person. But sometimes people do still refuse, but they are monitored quite closely during that period of time, and say it's not a one chance and then that's it, we're not going to bother trying to engage. The teams are constantly trying to re-engage, and it takes time to build that relationship. Quite often there is mistrust around sort of the council and authority as those people see. So that can take, sometimes a number of months to build that relationship and get that in. So yeah, please advise people, we do keep going back again. So you don't need to be doing that yourselves.
Thank you. Last speaker in the room is Councillor Bruce.
Thank you, Chair. With due respect, I'm going to go against what you were suggesting in terms of coming back in 3 months. And firstly, I wanted to say thank you to Kirsty and her team, because to be 6 is quite sad news, and there's obviously a lot of work to be done. Coming back to a meeting takes half a day out of someone's work. And I think for us, if we've got the data, the bench line that we look at now, in 3 months, it might be possible maybe for Kirsty to give us a written update that can be circulated to members, and then come back in 6 months for a meeting. But I don't think we need to see a meeting again in 3 months' time, personally.
Well, yeah, absolutely, and that's what I thought I meant, so sorry, but very good point. But Kirsty, if you do think you'd like to come back, because it's a lovely morning, away from the office, and you can explain the finite details to us, because you may want to. I was going to suggest that maybe you could give us this details by January at least, so you've got the winter period. If you've got the winter period, you could let us know how things are going. That'd be great. If you want to come with it, it would be very lovely to see you. And if you let Emma know, that would be fabulous, because there is some finite detail that maybe you being here, you've been able to answer lots of questions today, which has been really very, very helpful.
Thank you, Chair. I'm very happy to do a written report. What I would say is that our figures do lag, so there is a delay in kind of what we can provide in January, which is why we suggested the 6 months, because there is a time period of collecting that data. But I'm happy to provide a written update with some more detailed figures and that dashboard for you to obviously see. And then, yeah, happy to come back in 6 months' time and give you much more detail. As much as I enjoy being at the committee, there is an awful lot for us to get through as a service, and I'm keen that we make that progress as quickly and as effectively as possible.
And Councillor Bruce has said, your need is out there on the street, really. I just want to tell you something. When my child was at school, a man was homeless and he hadn't eaten, and my daughter went and bought him a pasty, and he said to her, unfortunately, what am I supposed to do with this? Broke her heart. And but she says to me now, they're not all like that. There's nice people, but do you know what I mean? It's just, you must get this as well. The point I'm raising that is that sometimes people want to be housed and they want to be helped, and you're going to get the others who don't want to be. So it's a difficult job. I wish you all the very best, and I look forward to seeing you as soon as you want to, but definitely in 6 months. But if you want to, we'll be very welcome to see you. Okay? Thank you, Chair. Thank you very much for today. Thank you. So I think everyone's happy. There's no questions been online, I don't think. I forgot to ask. Oh, and Councillor Bailey, you're the last one.
Well, it's not about, it's a general practical point on the meeting that I look at the screens, not everybody's being picked up on the camera. And I know particularly Kirsty hasn't appeared on the camera, and perhaps outside might want to see what she looks like.
The problem with that.
Might not.
No, it's the owl. It's the owl.
The problem with that in this meeting venue, we have to use an owl, and it goes on sound. So those of us that are sat nearer the owl will produce more sound. So it is unfortunate. I'm not sure Kirsty will regret that too much, but
Okay.
because the chair and myself and Emma are sat closest, it will be that, and that's
They
the
get to
best.
see it on the top line.
Yeah, you're the big focus. It must be just you clicking away.
It's always the big focus. Yes,
Thank you, Chair.
Thank you.
Right, thank you, Kirsty, thank you. I think you've got something else as well, but okay. Yes, you have. You've got the next item as well. So I think we're all happy with that. Then there's no recommendations, but I think we've gone forward with an action plan. Item 7 is Housing Task and Finish Group. Terms of reference. Have you all seen the terms of reference? Anybody happy? Anybody unhappy? Anybody wishes to say anything? Councillor Osborne and Councillor Trimnell.
Lucy, do you want to go before me? I'm not.
Just crack on. Councillor Trimnell, please.
No, all I wanted to say was to thank you for putting that together. Obviously, I wanted to bring this forward because, you know, now that we've got to a point where we have our housing team really working together in the adults team, we've got a really good sort of group of people working on this. I felt now is the time for us as councillors to be able to discuss this, learn, understand, and get to grips with the issues that housing faces in Somerset. So I'm really pleased. I wanted to thank you for the overview. I'm looking forward to the committee. I do have to say I may not be able to be on it because we need somebody who's going to be on it for the whole, for all of the meetings, and I may end up having to go for surgery. And so, but I wondered whether if that's the case, if somebody else else takes my place, when I'll be able to sort of be just there as a sort of in an observer capacity, perhaps, instead, just to see what's happening. Thank you.
Christine, I think we could bring the laptop to the hospital, couldn't we? I think that would be fine. I think we can work that one out. Don't worry about that. That's fine. Councillor Osborne.
Well, I certainly wish Lucy all the best with her surgery.
It might not happen, don't know.
Which may or may not happen, but if it does, good luck with that. But whether you'll actually want a laptop in your hospital bed with you is another story entirely. I guess let's play it by ear. How's the task and finish group or the findings? How's it going to be? How are the findings going to be reported and acted upon? For example, will the recommendations from the group go to executive? And will it be monitored? And will there be monitoring or a follow-up review once we've done the work?
Christine, I think, do you want to say? Yeah.
Yeah, it's probably just to say that I think this was posted as a terms of reference, but really it's an outline proposal. So we will have a full terms of reference. I would suggest that these recommendations come here, and then if you're happy that it's passed to executive, if there are specific recommendations.
Yeah.
Yeah, that's what I would prefer for us to meet as a task and finish, to be able to discuss, what's on it, what they want to go forward, and then we discuss it, and then we go forward to make a recommendation. The outward would be to make a recommendation. That's definitely what we want to do. So I think that's it. I think that'll be fine. Okay. Thank you for that. Thank you. Councillor Bruce.
Yeah, sorry, I may have missed something on this. I'm struggling to. How the cross-party membership, 8 councillors in total, all from the scrutiny committee?
In the beginning, yes, in the beginning. See, we're hoping for 8 members. I naturally assumed you'd be on it. And I think we just wanted to make sure that we offered it to members first. And then if we don't get enough, then we'd have to offer it to outside. But I think that's our idea, yeah.
Okay, so we haven't got to the point yet of defining dates or asking members to be on the group. Okay.
December is the date we're working on the outcome to be for December. I've asked Councillor Wakefield to be on it as well, because I think, fountain of knowledge you need there as well. Lucy, obviously I want as a shadow. Obviously I was expecting you and any other members who wish to be, great members. But, there are certain members I know got really interested in this, Councillor Osborne. So I think that that's what we're hoping for. But we're just setting this in place, and now we're going to be sending out with who we want to be on there. Or offers of who would like to be on there.
I'm just saying that I, of course, would like to be on it,
Yes.
but it is very dependent on dates and availability. So the earlier that we can get some outline dates so that we can maybe set those clear in our calendars would be really useful.
The other way around it is that we may do it online to start online, because we do know people are working. We do understand that many people are excellent, but they can't always get here. So I'm very with that, and I hope the government makes some decisions very soon on that, because it will help working members especially. So, don't worry, I've got you in mind, don't worry. Councillor Osborne, you're the last. Oh, no, you're not. Councillor Osborne and Councillor Bailey.
Okay, a couple of points. Just to say, as well as an observation from the scrutiny group, we did quite a lot online, and that seemed to work quite well. Although I do think you do need to mix in person in as well, so you keep that, I guess, team building ethos within there. Also, as well, in terms of involvement of external partners, are you planning to call external partners such as the registered providers, possibly tenants for lived experience, and some of the housing charities as well that deal with the issues? Are we going to be having like an evidence day where we maybe bring people in to actually pick their brains, so to speak? I think we did it once at South Somerset, one of the scrutinies.
I think once the group's formed, we can look at that, but we can't make people attend.
No.
I would hope that some key partners would want to attend, and I know from some of our partners they're very keen to be involved. So
absolutely they could come and we could have that opportunity for members of the task and finish group to ask those questions and gain a deeper understanding. But I think there's still quite a lot to be scoped out in the detail of this. So.
And very just quickly, will we be looking at possibly, at the moment, it seems as though the emphasis is on the sort of housing supply as such, but are we going to be, and home find and the sort of emphasis on that, as you say, the homelessness side is sort of separate and a separate team. But this was an opportunity here to bring that in because obviously the homeless side impacts on the housing supply. And at the moment, it's not clear that those are going to be integrated in, and we might be missing a trick if we don't.
I think naturally around demands, so those families and individuals that we've got who are homeless are on the housing register, although they are two separate things. So we will pick up on that demand and need amongst those that we've got a statutory duty to as part of this. So it will link in to the work, absolutely. So it will tie across and be joined in.
I think it is important though that we make sure that we do separate them. So we talk about one area and then we talk, because I think sometimes that waters get muddied quite quickly. I think that's the one thing we must make sure about. Councillor Bailey was.
Thank you, Chair. 2 points. Firstly, the briefing I think would be absolutely crucial, and probably Kirsty could put together the sort of background information that would be best able to allow this group to perform at the start, and then we can have that presentation. So I support what Councillor Osborne has already said. Second point is the element that's missing, and I'm sure it's going to be covered in December, is the finish bit of the test and finish. And if it's not, it has to be defined in December if it's not already defined. Otherwise, it could go on forever.
We have done, yeah.
But that's December, and I'm quite happy to be considered as a member of that group pending on the dates and my availability.
And I think if members could indicate, all members that they would like to be on it, please, I'm not coming back to you, Councillor Osborne, I'm not coming back to you, I'm sorry.
Just to indicate I was interested.
Yeah, I know you are. So what we're going to do is, so would you all please, would you approve the terms of reference, please? Do I all have you in agreement? Could you just show hands, please, all those in terms of reference? Thank you, that's approved. Thank you very, very much. And we will get cracking on the timescale. And please indicate to Emma that you would be interested to be on it. It would be really good, please. That's okay, because it's really good to, and I do appreciate that some people can't because of work, and we will work that out. I promise you, okay? So thank you very much. I think we need to know, I think by the next week, I think by the end of next week, if you could let us know who wants to be on it, okay? So thank you very much again. Thank you again, Kirsty, thank you. Item 10. Oh no, we're going to have, we're going to have a 9-minute break, 10-minute break, because we're a bit running behind. So if we can make it in 9 minutes, that'd be great. And then we come back to item 8. Thank you very much, thank you. Okay, members, we're now live. We're now live.
Is it a good thing? I'm like.
We are now live. We're starting the second part of the meeting, please. We're now on item 8. Item 8.
No one's giving me that cap.
Item 8, and this is the adults and health budget monitoring, pages 55 to 60. Can I invite Emily Fulbrook to present, please?
Thank you, Chair. Myself and Kirsty will do a little bit of a double act in terms of the adults and housing budget. This is a Q1 budget report, which I will take you through now. So in terms of overall in Q1, the adults and housing service are forecasting an overspend of 1.893 million. If we go down through, I'm not sharing my page, so I'm presuming that everybody has got the report in front of them. In terms of the adult social care spend, You will be able to see here in terms of across all of the service through physical disability, sensory loss, 65 plus, mental health and learning disabilities. We are in fact projecting an underspend across all of those areas. And this is a continuation of the progression from the My Life, My Future transformation programme, supporting with its main focus of supporting people to remain as independent and living in their own homes and in the community for as long as possible. We have seen across all the areas a reduction within our residential placements and an increase in community-based services. What we're also seeing is more people maintaining their independence and a continuation of our strength-based approach and decision-making in achieving the best possible outcome for individuals. We can also see here that we're supporting, particularly from a transition point of view, we are supporting people to transition through to adult services at a much younger age. So we are now assessing people when they are become 17 rather when they are already 18 and coming into crisis into the adult social care service. I'll pause there and just let Kirsty explain in terms of some of the budget within housing, and then I'll sum up.
Thanks, Emily. So I am going to talk in more detail about this on the next item, but you'll see from...
Kirsty, could you just tell us what page you're on each time?
Yes, I'm looking at page 56, which has got the table with the breakdown of finances. And if you look at towards the bottom of the table, under housing, there is a red showing an overspend there of 2.1 million. So it's increased previously, but I will talk in detail on the next item, Chair, about the reason for that overspend and what's happening to mitigate it. So it's quite a complex area. So happy to go into it much more detail on the next agenda item.
I just wanted to make sure members have got this. Emma did some large copies for everyone so that you could see it because the table is so small. Is that all right? So thank you.
So as Kirsty said, the next item for Kirsty will go into more details surrounding that. So with the underspend across adult social care has balanced out in terms of the overspend within the housing service, which has generated a forecasting us and a total overspend of 1.893 million. There's significant work that has been completed across adult social care and housing to continue in terms of the direction of travel across the adult social care service, but also some of the mitigations that we've also got in place surrounding the housing service, which again Kirsty will be going into more detail on. I'll open up for any questions.
Just explain before we go to the members. You're saying an overspend and an underspend, and can you just explain? Because I've written something down. We've got an overspend on the budget of 1.893 million, and then you said there was an underspend on all of the services. Can you just elaborate on that?
So on the table on page 56, so the table that you've got in front of you. So this is evidencing the totality of the adult social care and housing budget. So what we've got in terms of the adult social care service, we are predicting an underspend, but there is an overspend within the housing service, and the underspend within the adult social care service is balancing out the overspend within housing.
I see. So the housing, it's the housing.
Yes.
Sorry. I was trying to write as fast as you were speaking. I think that's why I needed to clarify. Thank you very much. Councillor Bailey.
Thank you, Chair. First, just want to commend all the Greens that are on there and pass my compliments on to those who've been involved in the process. It's often time to focus on just the Reds, and there are very few of those, and only one Amber. But we'll come back to Kirsty, I guess, for a bit more on the bottom red in the housing sector in a moment or two. I just want to ask a question on the obviously involvement with Newton. and where that is and when it finishes, if you like, if it hasn't done already and I've missed that, and whether we'll see a sign-off sort of situation and, if you like, steady as we go, continuing that progress report at some point. Emily, please.
So the My Life, My Future transformation programme continues. So whilst Newton colleagues have left their intensive work with adult social care, there has been a closeout report that was completed that did go to full council. We can absolutely share that back again with Scrutiny members if that would be helpful. But I wouldn't say it's all business as usual at the moment. It's moving into business as usual, and the new ways of working is continuing. And as you can see from the budget report, the sustainability of the My Life, My Future transformation programme has continued. We are still seeing some progression and good results within our neighbourhood, across our neighbourhood teams and within our learning disability service as well. Particular reference to our transitions, so our transition service as well, as part of that decision-making progress and the new ways of working and the approaches that we're undertaking as part of the My Life, My Future transformation programme. So it's ongoing. I don't think we'll ever do a mark off to say that we're done. It's just a continuation, and we are still seeing the results and the impact surrounding the My Life, My Future programme.
Thank you.
Councillor Trimlock.
Thank you, Chair. So, again, like you, I think it's fantastic to see so much green. It's almost a shame in some ways that the underspend couldn't be defined with a different colour to the on budget, to be honest with you, because actually those are numbers that we might not have imagined we would be able to see or achieve. So they're really good. My question is though, obviously the overall overspend, and not to blame housing because, you know, this is a tricky area and we know that we're sort of just starting to get to grips with it now, but housing is the responsible area for that. I really want to be clear, there's no blame, it is a circumstance. My concern is, and it's only in this budget because we've brought the two together, so it could have sat somewhere else. So my question is, because it's not a concern, if we continued to underspend on the adult social care budget, which is such a volatile area because in another month's time there could be a terrible illness, a flu, a pandemic or something that would absolutely put us back the other way. There's no danger of the budget being reduced in line with the amount that we apparently seem to need at the moment. That's something that I wanted to check. And I can see Councillor Wakefield. Yeah.
Councillor Wakefield, do you wish to?
Yeah, just to say that, I mean, obviously we're beginning to look at budgets for next year, and we are, although we've got pressures, we're asked to put forward pressures, but the savings or are going to be bigger than our pressures for next year, because yes, it's working well. I mean, there is obviously a risk. There are lots of risks out there and lots of unknowns. We've got some known unknowns, but we've got some unknown, I think, but I think the changes with the NHS they want to get people out of hospital quicker. So we are going to have to work very closely with our partners in the care provision services and with the NHS to make sure that if that makes our budget shoot up, then the government are going to have to fund that, because what they're doing is they're saving money on the NHS by getting people out of hospital and they're giving it to us. And traditionally they've just said, oh, the local authorities have to pay a bit more then. Well, that's going to be really difficult for us. But knowing what we know about who we get here coming out of the community, and the fact that, as we expected, we're spending less money on residential and nursing care and more money on people at home and having care at home and direct payments for people who are choosing their own care at home. So that is exactly as we expected. But the changes in the NHS are bigger than that and bigger than us, and that we are very aware of that, and we're talking to them about it all the time. But yes, to answer your question, we did, as you know, rebase the budget when we first started. We've put a huge extra amount of money into adult services. Because if you come in every year at, say, 17 million overdraw, and you're starting at a really difficult place to make your budget for the next year, we're not doing that anymore. And that is new and very welcome. But because we are making savings and because the council as a whole is still in struggling financially, as you all know, we are next year for the, as I just said before, the pressures we have identified will be outweighed by the savings we will make. So the budget will be actually slightly lower next year, I expect.
Thank you.
Councillor Osborne.
Thank you. Again, this is looking at budgets and market stability and also provider risk. So what contingency plans have we got in place should we have any major provider in Somerset fail? And how are we monitoring market stability to make sure that we protect continuity of care? Because apparently there is also an equipment provider that is looking at withdrawing from the market. And what would be the financial impact to us if another national equipment supplier decides to withdraw from the Somerset market? And how are we assessing again the exposure of providers to pay in PAYE national insurance liabilities? Because there are some sort of risks there from market stability. They're probably the known unknowns. But I was wondering what the plans were and the contingency to deal with that, especially if in the short term you're looking at underspends in adult care to offset some of the overspends we're seeing in the homelessness budget. And also the other question, to reinforce the point that I think I made earlier, was it's great the NHS want to put more people into reablement, get them out of hospital quicker because it manages the flow. But I fully support Councillor Wakefield in that it shouldn't be down to the local authority to pick up the cost for that, when actually, frankly, the NHS probably gets them above inflation settlements. So I would hope that there would be some flexibility in ensuring that some of those costs are shared and not just shunted onto us.
Okay. Thank you, Councillor Osborne. So if I start with the NHS side of things, first of all, so in terms of our intermediate care services, which is where somebody is discharged from hospital, at the moment that's a joint funded approach. So it's joint funded between the local authority, so adult social care, and the NHS. We do budget monitoring surrounding that service, which Paul Coles oversees, and also that is funded through the Better Care Fund as well. We are monitoring in terms of the outcomes for individuals that go through that pathway, and indeed then those individuals that have had their reablement service and then come on to adult social care. We know that good quality reablement means fewer people then requiring longer term adult social care services. So we're absolutely monitoring in terms of that. There is a risk with the changes within the health service of various potentially cost shunting from one service to another service. So we're working really closely with our NHS colleagues. However, there is a risk, and it's a known and unknown risk at this moment in time. In terms of market sustainability, again, our commissioning, it's a Care Act duty of ours. We need to ensure that we have got a sustainable market. There is a significant amount of work that goes on with our commissioning colleagues to ensure that. As you're aware, in terms of national living wage and national insurance, our providers will be asking for an increase in fees. There is a negotiation period as part of that. And we're currently working through that at the moment and meeting with providers at the moment. So I can't say what that fee level will be, but we're in those early negotiations with our provider market at the moment. You will see as part of this report, on from page 58 onwards, we do share it there in terms of our residential fee placement. So in terms of the weekly average cost for a newly commissioned residential placement is £865. Now that is above our published fee level at the moment. So we know that residential placements, whilst we're making fewer of them, we're not always getting them at the adult social care rate. In terms of our nursing placements, we are getting those placements at the adult social care rate. And for our older person mental health placements, we again are getting those placements at the adult social care rate. So we know where the pressures are, and we're monitoring and we're tracking through all of that. We know in terms of our home care what we're getting from a home care point of view, and we pay reasonably well in terms of the home care at the moment. And we know that we have got, in terms of our numbers of people waiting for home care, we're averaging about 1, maybe 2 people that are waiting for home care. So we know our home care market is good. We also know that our micro provider levels in Somerset is significantly high. So we know that we've got the care within the system. So the area that we do need to focus on is our residential area, which our commissioning colleagues are working on, and they're monitoring it. We also monitor in terms of bed availability. And what the capacity that we also have out there in the market as well. We monitor that on a daily basis. As our commissioning colleagues are monitoring that as well. In terms of provider failure or provider handbacks, we've got really good relationships with the RCPA, who we meet with on a regular basis. We do lots of early prevention work with our providers as well, because it's in our interest to support providers rather than having, as you're all aware of the homes that we have had where they have gone into failure and we've had to move a number of people, and that's somebody's home, and it can be very traumatic actually for individuals and family members alike, and also for the workforce that are working within that setting as well. So we do lots of early prevention work within the market, but it's something that is overseen across our commissioning colleagues. Hopefully that answers your question.
Yes, thank you for your answer, Emily. You're in command of your brief as ever. So thank you for your full answers there. Are we going to be under the phase 2 transformation? Because we've already had Newton doing a significant amount of work, and you've got the report, and I think I wouldn't mind seeing that again, so that would be helpful. Is Newton going to be involved with adult social care and housing going forward?
Absolutely.
And what sort of areas are you going to be focusing on with them this time round?
We have various meetings coming up with Newton to explore just that. So as we did with the My Life, My Future programme, we did that diagnostic. So we really identified those areas where Newton felt that that we could expand, and that we could, with new ways of working, we could not only in terms of achieve better outcomes for people, but also achieve savings as well. So Newton have got good understanding in terms of adult social care. They've also been and done the diagnostic within housing, so we know that the opportunities that we've got within housing. So we will do a light touch refresh. I can't say to you what exactly areas that will be, but there will be much more work surrounding that prevention, that early help and intervention, so that demand management as well. So that will, and the continuation and sort of paceness in terms of for our transition work as well. There is probably some work surrounding our working age adults. So some of you may be aware of the work that the CCN did with Newton in terms of working age adults, so particularly mental health and learning disabilities. There's probably some areas of work that we can do there, and connected work programme as well. So there's lots of opportunities that we can continue to look at.
Right, so what's the timeline for that? And when is the business case going to come forward?
I've actually got a meeting with Newton later on today, so we will know in the coming weeks of what the timeframes will be surrounding that.
Thank you, Councillor Osborne. Thank you. I do agree with Councillor Trimnell. It's a whole thing to say you don't want housing in, but of course you do. But of course it does sort of scupper and we would have only been 0.7 something had we overspent, had we not had the housing. So it would be nice if it was in a different colour, but that's just being silly. So the areas where we've got to look at with housing is the housing option. That is our mainstay of where we're overspending. And as you explained today, that's quite complex, and it's something that obviously Newton will look into where we can better it, but keep to the quality. It's important, isn't it? It's not just about money. It's about keeping our quality for housing. Yes?
Yeah, within all of this, there's significant work has been done in terms of the adult social care and housing budget, and we are one service, so we work together and we support each other. And yes, Kirsty will definitely be sort of talking about some of the mitigations and the plans that have already started, so not just necessarily waiting for Newton to come in, that there are already actions and mitigations underway.
That's absolutely super. Thank you very much. So, sorry, Councillor Bailey. I looked up a minute ago and I just missed you, sorry.
Yes, I was dodging when you looked. Thank you, Chair. I just wanted to come back to a big picture situation which has been on the agenda for so long now, which is the integrated working between the NHS and social care. And I just wondered, and I know that's happening on the ground, well, in some places, others it isn't. I'll give an example in a moment or two. I just wonder what the role of this committee could be in sort of ensuring that pushes forward, because I don't know, my memory is probably wrong, but I guess it was about 2015-16 when social care came to county, and it was all about integration then, and it still is on the cards. And residents don't see a change. Anybody else doesn't see a difference or a separation, and yet we seem to struggle to move that forward. Now, a little example on a local basis: appointments were stopped in Martock and moved to South Betherton. Fine, a great idea. It was good for Symphony, but there's no access. There's no service, the bus service between the two. So, with a bit of forethought, and now there is. We've done that with a DRT service. But with a bit of forethought, somebody could have said, hang on a minute, how do people get from A to B? With the best will in the world, most of the people that are in the, certainly in the GP system and hospital system, are of an advancing age and aren't able to drive, don't have access, and certainly probably not as equipped online. So that's an example, but I wonder what the role, my question is in the big picture, what the role is of this committee in supporting you in ensuring that the NHS works together more closely with this. And I have to say, meetings that we've had previously where they're unable to present timescales doesn't help the situation. And I don't tell people a lot about that because I don't think at the ground level residents want to hear that. So that's where this work committee might fit in terms of that big picture.
Councillor Wakefield.
Councillor, that's a really interesting point you make. And actually, one of the first things I said to the NHS when I was put into this role at the first meeting, I said, well, what we need to talk about today is intermediate care. And they went, we talk about nothing else. And I thought, well, you're not getting anywhere if it's still the thing. The first thing that hit me was how well it didn't work, as you say. And there have been changes to the way it's done. And I'm hoping that the changes that are happening at the NHS, the hopefully less bureaucratic approach and a more practical approach will help, because there's definitely a difference between what we think is a patient can come out of hospital and they think a patient can come out of hospital, and when they're ready to hand them over to us isn't always the time that we're ready to take them. We're ready to take them, but they're not ready to hand them over. They haven't had the drug sorted out, or the nurse hasn't been round, or the doctor hasn't. And there's all those things that interface between the two is really hard to manage well. We now have a transfer of care hub at the hospital started last year, and that is a mixture of social workers and workers from the hospital trying to smooth that pathway. And the intermediate care service, this is a joint commission service as far as I understand, didn't necessarily or doesn't always have the right number of people in it. That's something we're talking to the NHS about, and the fact that we've got to get people from A to B. We've got to have people waiting for them when they go home or ready to deal with them when they get home. That's quite a complicated thing to work out for each person. It's happening on a daily basis for a number of people every day. So it's quite a big thing to organise, but it could be better. And we're definitely on the board, it's on the Somerset board, and the other things we deal with the NHS, we are talking about how to make that better. Now, when you talk about people in the community, the rural community, and again, I said this at the last board, they're talking about having a different way of providing GP services. And we have got some across Taunton and Somerset. We have got places where you ring up your GP and you might get put straight through to a pharmacist rather than a GP because that's what they think you need. They kind of triage it at that point. And we said, look, you're talking about these hubs, but that's not going to work if you live in the country. And they said, well, obviously we're going to have to start in the towns. And I said, okay, as long as you're doing provision for the country and you're thinking about people getting access, a slinky bus, whatever it happens to be, they need something to be able to get to the points where the new, we talked about the community hospitals where they're going to provide some of the cancer treatment, they're going to provide some diagnostic services, but that's fine as long as you can get there, as you rightly said. So these are in our minds, but certainly I would say we haven't got to the point where they've actually implemented all of this yet. They're trying to improve it with our help, and we do talk to them all the time about it, but we can say in adult social care, we've got nobody waiting to come out of hospital that we can't deal with. But they might say, well, we've got people we can't get rid of. But that's possibly their choice rather than ours. Or families say, actually, we don't want dad to come home. We can't cope with him. We're saying, well, they could go home actually with the right care. You know, we assess them. So we are less keen to put people in care homes, as we've said, because we don't think it's the right place. We're less keen to keep them in community hospitals because they get deconditioning there and reablement is harder rather than better. And all those things are happening, but you're absolutely right to say, well, where can I see the results of this? We will try and bring that. We will try and get the results of what's happening and show you the baseline and show you the figures going forward as to how we hope it's improving. But I do think intermediate care and those discharges in hospital are an area that requires constant thought and constant improvement.
Thank you very much.
Thank you. I'm pleased to hear about that help. So.
Thank you, Councillor Bailey. Councillor Bruce.
Thank you. Just wanted some clarification in terms of, like, I'll say straight off, I know you guys don't have a crystal ball, but this 16 and 25% increase is quite considerable. Just to get an idea, is it something that was kind of expected or has it come out of the blue? Because it does feel a little bit like obviously with the next item, we're going to cover actions and things that we're taking actions now, mitigating actions, but could we not have acted a little bit earlier, or is this come out of the blue and it's something that we're having to deal with now on a reactive basis because we have no other choice? And then kind of linking in with the next item, so you might want to deal with it then, but you also say there that the current figures indicate a similar trend for the next year. Is that taking into account the mitigating actions, that even with those actions we're going to have a similar increase in the next year, or is that increase going to be reduced by the mitigating actions? Thank you.
I think Kirsty's going to answer this, but I'm just going to say about the numbers. One of the things that I think actually Councillor Perry referred, COVID had a very long tail. They gave us money, as Kirsty Larkin said, but they cut it off quite suddenly. And the long tail of people who were disabled in a way by COVID and have been kept out of work or out of the workplace, people who were furloughed. It didn't always work, just going back to work, it didn't work for them. We've got people, you know, they always say, don't they, you only have to have 3 horrible things happen to you and you could be homeless. Anybody could be homeless. And on Monday at the brew house, at the event we did for homelessness, we had the film I, Daniel Blake, played there, which is all about somebody for whom that happens really. He just gets unhealthy, can't get any benefits, can't get back into work, and he just falls through the cracks of the services. And I think that what's happened after COVID and after people have gone back to work has meant that some people haven't been able to. Some people, because of the financial crisis that we had and the increase in mortgage payments and all the rest of it, have lost their homes. There's been a whole set of things that have happened. Did we expect it? Probably not as much as it's happened, and probably not as much in Somerset as it's happened, actually. We're a rural county where wages are lower than across many parts of the country. So there's, you know, people already on low incomes. There's not enough accommodation. We've had the phosphate issue, which means we haven't built enough accommodation over the last few years. We haven't been able to build. And now there's a slowdown because people can't get mortgages. So their builders are just slowing down the builds that they're doing. So we've got all those problems with homes and also finances. And I think the health of the nation, certainly the mental health of the nation, has struggled to recover from COVID. So those are my views, but I think Kirsty's probably got more to add.
Kirsty, do you have anything you wish to say?
Thank you, Chair. I'll be brief because I think I will pick some of this up in the next discussion point. Yes, we have seen that increase coming. It's a national issue, though. It's not not a Somerset issue, sadly. It's been replicated across the country. We are slightly higher though than the sort of national average. It's been around 11% kind of increase in homelessness, sort of the national average. We're at 16%. The spend, you will have seen, no doubt, members, in the news about spend on temporary accommodation, how much it's costing the country. Again, national issue. There are some things pertinent to Somerset that have made it slightly more complex. So I think Councillor Wakefield's mentioned, obviously, sort of our wages compared to house prices. We've obviously had Hinkley coming, which is amazing for the economy, and we've got Gravitas, which is also really good for the economy, but that has impacted the availability of accommodation. So not just within kind of the Bridgewater area, but we've noticed that is spreading further out as work progresses, and we're not quite at the peak yet of those workers coming in. Again, national issue, local housing allowance is reflective of the true cost of privately rented accommodation. So it's very difficult to secure privately rented accommodation. Yes, there's a number of factors. We have seen that coming, and it has been increasing over the last probably five years or so. We've seen that increase. I'll talk about mitigation later on.
I think the next item, but let's just thank you very, very much, Chris. Thank you for Councillor Whitfield as well.
Oh, I do apologise. You can hear me. Sorry. So we're going to note the adult services and the budget position. And I think we've had a good, I think we all know where we are. I think we're quite clear. Thank you very much for that. So I don't think, it's a sort of a wait and see, isn't it? It's a sort of a, when we're going to go through this and find out details and deeper dive into all of this. I think that's what we really want to do. I hope everyone's happy with that. So I'm going to move on to the next item now, which is item 9, temporary accommodation update. And I'll invite somebody new, Kirsty Larkins, to present.
Yes, sorry you've had so much of me this morning. So, yeah, following on from obviously the budget report, you can see that we've got that overspend in housing. So let's just talk in much more detail about why we've got that overspend, but also the mitigations that we're putting in place, so the committee are informed. So I just thought it would be quite helpful to have some background information. So this is obviously to note the report. So we have a statutory duty to provide temporary accommodation. Sorry, I'm having screen trouble. To individuals that are homeless, eligible for assistance and in priority need. So if you are a fit, healthy person with no dependent children, we do not have to provide temporary accommodation, and we don't receive funding for that either. So it is those people that have either got dependent children or have got health problems, which means you're less able to fend for yourself should you experience homelessness. That's the legislation, and that's the guidance. It's always our preferred option to try and prevent homelessness or delay it so we can do planned moves. And a huge part of the work that we do going forward is about that preventative approach. It links really nicely, I think, with doing more in neighbourhoods and kind of the work around health that's going on with adult social care. So that real prevent agenda across all of the kind of system. When we can't prevent or we can't do a planned move, then we have to place people into temporary accommodation, including sometimes bed and breakfast accommodation. And that reliance on bed and breakfast accommodation at the moment has resulted in that overspend. And I've just linked the report that went to executive, but you've obviously seen through the previous item the figures that we've got currently. And appreciate this is not very big on the screen, but is in the report pack, but I can't see which page number because I'm on my screen, so apologies. 64, thank you. So this is a comparison with our nearest neighbours. There is quite a lag in that data, as I was saying before, we don't get, but I thought it was helpful that you could see that kind of comparison with other local authorities. So Somerset is a sort of yellow line that you can see increasing, and this is the number of kind of homeless approaches we've had to the authority. The orange line is Dorset, who's running above, and Cornwall went off scale and come back in again. But you can see there's a trend across all of those that is increasing across our nearest comparators, but it is a national issue. And then this one is around, again, those nearest neighbour comparators, but households that we've got in bed and breakfast accommodation. So that is families and singles as well. And you can see Somerset again is that yellow line, and you can see that is increasing across. Similar picture for Cornwall. Other areas are starting to dip down, and I think that's really interesting. There's lessons to be learned where authorities have come together prior to us. So you look at kind of Dorset that have obviously started their local government reorganisation several years ahead of Somerset, and I think are starting to see a different position now.
Kirsty, can I just ask a question, please? It's showing 2024. We've got no data for showing up to now.
So sadly, these are statistics that are provided by the MHCLG. So I can provide the statistics for Somerset. What I don't have is that nearest neighbour comparator. And this is what I'm saying, they run at a real lag, which is really frustrating. And I would love to be able to share with you the much more up-to-date picture, but this is as up-to-date as we have at the moment. Once we have that more detailed nearest neighbour, I'm happily share that, but there will be a lag again compared to where we are in that journey, and I know that is frustrating.
Well, I think even if we had Somerset, it would be something up to date,
Yeah,
or near as possible, you know.
fine. Yeah, no problem, noted. So one of the questions I think that came up earlier was around our performance and key performance indicators, and again I thought it was helpful to share. So a number of these, as you can see, are new indicators that weren't previously included in that overview for the council. So that's around average length of time in bed and breakfast by singles, average length of time by couples, and also length of stay in temporary accommodation broken down by families, and length of stay in temporary accommodation by singles and couples. We were previously recording the number of families with dependent children living in bed and breakfast. So just to kind of say, we are recording a lot more data as part of those key performance indicators. You will see that a number of them are amber currently, and I will talk about how we are trying to work to mitigate those and get those to green. There are a number of other indicators around the number of cases we are preventing from being homeless as well, which I think for us is a real key indicator. If we're preventing more, that then reduces the costs that go on around temporary accommodation and bed and breakfast. So just a bit of context, I have already provided some of this, but we have seen that increased demand from service users. We're seeing that service users coming in are more complex, either individuals or the family unit. We think some of that is linked to the impact of COVID. It's hard to map all of that, but we definitely think that's had an impact on people's mental health and physical health, and that's then impacted on their housing situation as well.
Kirsty, just another point. Sorry, why we're doing this, because I just want to explain. So we haven't got this defined either to north, south, east, or west, have we? Is there any way that we would, because it would be good to know where it's worse in a certain area than others?
So we can provide those figures, but again, from an MHCLG, they always tell me off if I provide them, as they like us to treat it as the whole of Somerset and move away from thinking it as districts. We know we've got higher demand in Taunton around bed and breakfast accommodation. We have the highest number of approaches in Taunton as well. And I think that's always been linked to it being the county town, and it has got easier links for people to get to than perhaps some of our other outliers.
I think what I'm suggesting is that you mentioned Hinkley Point, we've got gravitas, we've got various issues here, in Bridgewater particularly, which would affect Taunton as well. It just would be good to know, because that makes our weight of argument when we're talking to accommodation with HPC. it also links that weight to the argument. So it would be really good if we had that.
And Christian has provided that around Hinkley Point C and those negotiations and the accommodation strategy. That is being tied up into what we require and what we're hoping to be mitigated by that piece of work. So just to reassure, that link is happening across.
Good.
As I've already mentioned, we saw a 16% increase in homelessness and a 25% increase in the use of bed and breakfast and temporary accommodation. And what we're seeing is once people go into that type of accommodation, they are staying in the accommodation for longer. And that's because we are struggling with suitable, affordable housing for people to move into, whether that be social housing or housing in the private sector. It's a very competitive market, as I've already mentioned. Rental prices are much higher if somebody is dependent on local housing allowance, or families that are working but on low incomes are priced out of that market, unfortunately. So it is quite a difficult picture within Somerset, and that is for the whole of Somerset. It's not just one area. We felt it more strongly in the Bridgewater and then Taunton area, but it is replicated across the south and east of the county as well. Just some figures that we've got. So average number of nights spent in all temporary accommodations for households with no dependent children. So this is singles and couples is 204. Households with dependent children is 163 nights. And it's just worth explaining that temporary accommodation could be self-contained units of accommodation. So we work really closely with our providers to commission self-contained accommodation, especially for families. And we've got really good provision in some areas, but we need more of that provision as we move forward. It could be a room in a hostel shared facilities. There is a mixture of temporary accommodation out there, depending on what's most appropriate. Sometimes we don't have an option and we have to go with what we've got available, but we do try and keep people in the area that they need to be in. Sometimes that is not possible because there is nothing else available, but we still must provide accommodation. So as far as possible, we keep people in the area they need to be in, whether that's schooling, family support, accessing health services. So we try to make that happen. It doesn't always happen. I know people get calls about that, but it is about that availability. And then those nights spent in bed and breakfast. So again, households with no dependent children, 124. Households with dependent children, 23. We are good at keeping to the government target of having no families over 6 weeks in bed and breakfast accommodation. However, for me, any nights spent as a family in bed and breakfast accommodation for temporary accommodation is too many. That impact on that family is huge, and that disruption that it can cause to schooling and all those other things is massive, and that is long felt through their childhood and then on into adulthood. We are also really successful, so we do have some real positives around our 16 to 17-year-olds. So we have a jointly commissioned service with our children's social care called Thrive 16 Plus, not to be confused with the new renamed Somerset Council, which is also Thrive. We have no 16 or 17-year-olds in bed and breakfast accommodation, which is really positive and actually is not the picture nationally. We absolutely have more. Yeah, we're doing really well in that area, and it's an area I know we're particularly proud of alongside children's social care. So we're taking a number of steps around trying to reduce the costs, and some of these are quite quick term wins and some of them are longer term. So we've negotiated cheaper rates of bed and breakfast by block booking bed and breakfast, so it's much more cost efficient and reduces our costs down. We're bringing on board additional privately rented accommodation, again, to reduce that reliance on bed and breakfast and temporary accommodation. So we do have landlords approach us that are interested in working with us. And we are looking at models for us to be able to do that, to minimise the risk for the council, but also maximise the amount of accommodation that we can bring on board. And we're looking at working with partners to kind of put that support in for the landlord so they can be quite hands-off, have a guaranteed income, and then we've got support wrapped around that. We just had the business case approved by executive, which went to full council for the housing revenue account to use their underspend last year to provide additional accommodation units. We're hoping that will be around 15 units. That is a drop in the iceberg, though, I would say. We've got 355 households in temporary accommodation across the county at the moment, but it's the steps in the right direction, and some of these are more strategic and longer term. With our contracts, we've negotiated minimal or zero uplifts for 24-25. We will try again, obviously, as we move forward for 25-26. We're also working really closely with our registered partners to see if they will give more preference to those applicants that we owe a homeless duty to, so that they get more opportunity to be housed through that register when we get the flow through. Obviously, there is only so much social housing. Last year, we had around 1,500 lets across the county. We have 12,500 people on the housing register. So that disparity between demands and what we've actually got available is huge, and that obviously adds some complexities. But as I mentioned before, some of the longer term is around that preventative course of action. So as part of the new structure we've set up, as Councillor Wakefield mentioned, we have a homeless prevention team that are working with clients much further upstream to try and prevent them from becoming homeless. Alongside that, we've got some work going on with our digital colleagues as well, around using the data we have available to us as a council to be able to start targeting households where they might not recognise that they have a risk of becoming homeless, but we recognise through that data, so we can be working much more upstream, but also that joined up working across with children, with adults, with health. So we're working with that household in the most appropriate way. That takes time, though. That's not a quick, 6 months. That's a couple of years to start seeing that work through. But incredibly exciting, and got a huge amount of potential for us to do that. If we do that, that reduces the numbers then that are coming in needing temporary accommodation and bed and breakfast accommodation, and that's how we mitigate and get that figure down. What we're working on at the moment is some modelling as to what that looks like, so we haven't quite got that yet. We are working on some modelling around if we can reduce X down, what does that do? What does that do to the spend? Alongside that, we've got some new roles coming into the service that will support with us reducing where we've got people that have been in bed and breakfast or temporary accommodation longer term, that we think we've got good options to move on into more suitable accommodations for some more intensive support in that space as well. Once we've got the modelling, I will obviously share that with the Scrutiny committee. The other piece we put in place is a bed and breakfast reduction board. So that's an officer board. We meet fortnightly, and that's, I've already mentioned these. So to look at 5 key areas: that prevention or delay, void minimisation, so making sure where we have got voids in temporary accommodation, so not the HRA side, that we are quickly referring and getting people in as effectively and as quickly as possible. Improved process management, so we've already started quite a lot of service redesign within the housing service. So on the back of Newton coming in and doing that diagnostic, that was really helpful in around some of the data and clarifying and confirming what we already felt were some of the steps that were needed. So we've started to put those into play. I'm very much hopeful that we'll be working a lot more closely with them and have some additional support in, but that work's still ongoing across the kind of inspiring innovation transformation project across the council. So we're still kind of working that through. The other parts around maximising income to the council, that's around housing benefit and ensuring that we are claiming, or our residents are claiming everything they can claim through housing benefit and clawing that money back through that system. So where we're paying out for accommodation, we will apply for housing benefit, and then the housing benefit comes back into the housing general fund to offset some of that. What hasn't been good over the past few years is the process behind that and ensuring that we are claiming in every single case and that we're doing that quickly and effectively. We've met, I think it's next week, we're meeting with our housing benefit colleagues to use. So there's similar to housing in that they were operating different processes from being a hangover from being district services, but to get agreement that we have one single process and it's a much more streamlined, effective, efficient process for us. So maximising that income back in. And then I've mentioned about commissioning of services for complex people, so we have less that are in bed and breakfast accommodation or temporary accommodation. They're going into more suitable accommodation much earlier and getting the support that they need. And either they may need to remain in that accommodation for a longer period of time, or then looking to move on to alternatives. There's quite a lot going on in this space at the moment. It's quite complex. And I haven't got as much of the detail around the modelling as I would like at the moment, but we can bring that and share that with the committee. Hopefully that is useful.
Thank you, Kirsty. That, I think that's it, isn't it, your slides? I wanted to ask you a question before I put it to the committee. It's a sort of a home finder plus homeless plus, it's a naughty one really. But how do you deal with people that have got accommodation, are in the wrong accommodation, have got mental health issues, making them now thinking of making themselves homeless because they have to start the whole process again? Because when you ring Somerset Council, it says they've got to start the home finder again. They go back on the register and they start the whole process again. But if they make themselves homeless, they'll get seen straight away. You must get a lot of that. You must get people who can't cope anymore. And they were living in not supported housing, but need to be moved into supported housing. Do you get any of that? I mean, does that happen? I get quite a few calls about this.
We do get some, and yes, they would need to re-register, because once somebody is housed from the register, their application is closed. So they would need to reapply, which is why they have to reapply. We do give banding awards for people around mental health, welfare, medical conditions. So it's not necessary that they would be at the bottom of the queue, as it were. So they are given priority. They could be in, depending how severe it is, there's emergency gold and silver and bronze, that all, depending on the impact the housing situation is having on somebody's health, can be reflected through that. What people sometimes forget is that they may have a health condition, and it could be a very serious health condition, but moving actually isn't going to make any difference to that health condition. And sometimes people find that hard to understand, but you know, I've got a really serious, I don't know, heart disease or suffering with cancer, which is really serious, but they're in suitable accommodations. They are not going to get a priority to move into other accommodation. If, however, they were in a third floor flat and they needed adapted wheelchair access accommodation, obviously that accommodation they're currently in isn't suitable. They would be given a higher priority, and we would work really closely with our colleagues in adult social care and our housing OTs to find suitable accommodation as quickly as possible. That still takes time though, I'm going to be honest. You know, there isn't a magic wand that we can wave. There aren't sets of keys that we've all got stashed away, unfortunately. So even in the most urgent cases, because of the demand and lack of supply, that can still take time.
Well, thank you for that relief. I did give them the right advice. This is severe mental. So it's somebody that needs to be in support, somebody to keep an eye on them. So it's a little different, but thank you. I did give them the right information. That makes me feel much better. Thank you. Councillor Osborne.
Thank you. Yeah, an interesting report, Kirsty. It sort of reminds me of some of the things we were doing in South Somerset. And sadly, I remember in the early days of being elected, we did have a problem with B&B costs. And it always seemed like dead money because you were getting nothing in return because people were still out on the street during the day. And we did manage to solve that. We also had service level agreements with Citizens Advice Bureau for doing some of the assessment work to ensure that people were claiming correctly whatever they needed to claim, and also for doing tribunal work as well, where that could put people at risk if they're in danger of losing some of the allowances. Do we still use CAB for that work?
We do. I think we're one of the only services now within the council that actually does provide funding, and it is around that financial support, maximisation of benefits, also supporting people who are in debt around applying for relief orders and everything. So we do. Again, we're working with Citizens Advice to check that that's still fit for purpose. They're an excellent organisation, but the world has changed. And as you'll know, Sue, we did have our in-house service at one point as well, which was hugely successful. A lot of this is similar to what we needed to do in the south of the county, and we've got really experienced officers from all of the county involved in this work. So I do believe we can tackle it. I believe we can reduce the spend down and mitigate this, but it does take time. It's not a 6 months, it's not a year. Some of this to come to fruition will be several years.
Yeah, so how are we going to sort of manage in the interim with the enormous budget pressures we've got? And then I think Newton are only just going to start, I think contracts due to be signed imminently. And then they've got to do the diagnostics. So how are we going to manage to ensure that you can deliver what you need to deliver without succumbing to pressure, to budget pressures?
So Newton have already done a diagnostics with the housing team. So one of the really good things about coming into the adult social care service was that Newton had obviously been working, and before I started my role, Mel had kind of instigated a review for housing, which was actually incredibly helpful, alongside some work Shelter did with us as well around our case reviews and quality of the work within the service. So we have got that. Some of these mitigations around block booking, better housekeeping within the service, we'll start to see that drop down. We certainly did previously when we deployed those. So those things will start to see it drop. It won't drop significantly enough to what we would like, but the longer term things will then hopefully kick in. So that's how we're mitigating.
Yeah,
Thank you.
just a couple more points.
Just a quick one, councillor Osborne.
It's just a very quick one, but the housing service, or homeless service, is actually sort of one of the early 2 items identified by the Modern AI and Modern Data Programme, MDAIC, I think it is. How is that going to click in with Newton? And how long before you think that you are going to see benefits from that particular work stream?
So it fits alongside the Newton diagnostic really well. We recognise, and I've actually seen in other councils where they've used, not as technically advanced as we're hoping for, but have used similar data when I've been at conferences. So it's something I've been chatting to our digital team for a really long time about, kind of going, could do something in homelessness and housing. And it's something that Newton recognised actually around that data analytics and some of that work. We can start working much more at strength. So it fits really nicely. We had a service away day yesterday, and Josh, who's leading that work, came and spoke to us. We're hoping to have some provisional kind of data sort of springtime next year. And then hopefully, I think they're hoping the whole platform will come online towards the end of the year, because there's several layers to the work that's done. Once that starts coming on in spring, we should start seeing a difference. But again, it will take a little bit of while for that to filter through the system. So you're probably looking at sort of a year later to start seeing some of that change around some of our performance statistics.
Thank you very much, Kirsty. Thank you very much, councillor Osborne. You were the only good questions. Thank you very much. Kirsty, I'd like to thank you today. I think that obviously the temporary accommodation issue is a big issue, something we really worry about. And I think you can hear the committee is really interested in the housing side of things. It meets so many criteria. And so I think we really sort of are so interested, and probably, you know, you're thinking you've had a hard day today, but you've done very, very well. And I want to thank you very much, and Councillor Wakefield and Emily for the help. So thank you very much. Thank you. Okay, now that's the end of the meeting, and not quite. I need to tell you something, and I just wish you would just stand by a minute while I tell you this information that is just hot. Which is sad. This is from Mel Locke, our Executive Director of Adult Social Care and Housing. Hope you're all doing well. I wanted to share some significant news with you As of the 6th of April, I'll be retiring from my role at Somerset Council. Although some of you are already aware, for those that aren't, I want to inform you about my retirement before you see the job advert. I worked for Somerset and held various roles that have brought me immense satisfaction. My current role of Executive Director of Adult Social Care and Housing has been a true honour and a source of great personal fulfilment. Reflecting on the recent CQC visit, I am filled with pride for all that we've accomplished together. Your dedication and hard work has been truly inspiring and has been a privilege to me as part of an exceptional team. I still have another 5 months here, so don't get rid of me yet, and I'm excited about what we can accomplish in the next few months. I just wanted to take this opportunity for us to minute how I'm very, very sad because Mel, and I'm sad obviously for portfolio holder and Emily and all officers, because Mel has just been our stronghold and this obviously for Somerset Council and especially for adult social care. So I'm going to spend the next 5 months with her every day to learn as much as I can from her, so I won't let you down. No, I don't think I'll apply for the job, but I just wanted us to record that how grateful we are to her, and she is going to be an immense loss to Somerset. Absolutely incredible. The knowledge that she has is invaluable. So we want to wish her all the very best. She's far too young to retire, but maybe that's what she wants to do. But just wanted to share that with you, and I know you'll agree with me. I wish her all the very, very best.
Thank you. Yeah.
Okay, I now declare the meeting closed and notice people before 1 o'clock.